Hi everyone, I am Annie, one of the OET trainers from Bemax Academy. First of all, I wish everyone a happy new year, and it's very happy for us to come with the writing module grammar, that especially for our occupational English test. So I think all members have so many doubts because the coming weeks, these 2 weeks, I think everyone is preparing for their OET exams, especially on 11th and last of January. So we are hoping it will be very useful for the students going on through with these classes. And first of all, we can see that whatever the grammar that we can go through that, the first and the most important one, how to write a letter. So for the letter means, first of all we want to know how to write introductory. So which is the most important part of a letter? If anyone will ask you a question, that one, which is the most important part of a letter, you have to tell that a letter has 3 parts. That will be address to introduction, body paragraph and conclusion. This is the 3 parts that we have to follow with that one. And after going through with that one, I know that majority of the students have doubts will be there. When you are getting the time for writing the case notes and how I have to start, where I start to read, this is the common doubt that you have. So when you are getting the case note, you have to point out the first 4 things. First one, you have to check it, who is the reader. Second one, what is the purpose. And the third one, whether it is a known or unknown case. And you have to see that it is the current situation of the patient. These 4 important parts, first you have to check it. First one, you have to check the purpose, who is the reader. Then we have to check, is it a known case, or then we can come to that, what is the current condition of the patient. So this is after that one, we want to know that what are the different type of letters that we have. First one is, we know that referral letter, non-case letter, house visit, transfer letter, discharge letter. So how you have to write the introduction. So we are coming to that and coming to the next section of that one. So I will come with a little more explanation when I am giving an introductory, how to write the introductory in each and every case notes. So you see, the first one is the referral letter. We know that one, when you are writing the referral means, we know that one referring the patient to another professionals or from one center to another side. So I am writing to refer Mr. John, who requires continuous care and management. He was diagnosed with a peptic ulcer. So what you have to point out in that one, especially when you are writing the introduction, PPD. That is the most important 3 letters you have to keep it in your mind. What does P means? In the introduction you have to write the patient name. And secondly, you have to write the purpose. And thirdly, you have to write the disease condition. Like this, you have to go through with the introduction. Means this is the 3 important parts: patient name, purpose, disease condition. These are the 3 letters you have to keep it in the mind. And I think some of them have idea is there how to write this referral letter. We know that one. But the main doubt is that how to write a continuous care, where I want to write, where to use, that is the most important doubt. Continuous care or continued care I want to write, or ongoing care I want to write. So when you are writing a letter, first of all we have to think about that, where I should use continuous care or continued care or ongoing care. You see, continuous care means that will be only for a limited period of time that you have to give, maybe 2 or 3 months. But continued care or ongoing care, that you have to give for the patient throughout the period, throughout. So, especially where we will use means whenever we are writing the letter to a community nurse or the nurses of a home care nurse or nurses of old care home or community health nurses. For these nurses only we will write the purpose like this. And for the doctors, when you are writing the purpose, when you are writing letter to doctors, please go through further care or follow-up care. Finally, it is very important. And third one, sorry, third one, whenever you are writing occupational therapist or speech therapist or for physiotherapist, if you are writing the letter, you must have to write rehabilitation care or rehabilitative care. So, you know that, sorry, with your permission. And rehabilitative care or rehabilitation care. So, if you are writing the letter to an occupational therapist or a speech therapist or a physiotherapist, you can write this one as the purpose. And we know that one especially for if you want to write an urgent assessment or you are writing the letter to an administrator. So, you can maybe the patient will be we know that one the patient who has not been cured or a dying patient will be there. We will provide them with a palliative care or health care or hospice care. So, we will provide them. So, this is the purpose we have to point out when you are writing the letters. So, how to use and where to use? Please check it. Purposes according to the reader we must have to change. So, continuous care or continued care, ongoing care, whenever we are writing the letter to nurse or home care nurses, nurses of old age care home, community health nurse. And when you want to write the letter to doctors, so please note that one, the purpose must be further care or follow-up care. So, this is the first all things that you have to note. The second step, what is the difference between? The third doubt will come in the introduction. How I will, everywhere I want to write was diagnosed with or has been diagnosed with, like this some doubts will be there. So, you have to write was diagnosed means Mr. John or he was diagnosed with, because if the patient has short term conditions like pneumonia or diarrhea. So, if the patient has pneumonia or diarrhea, that means within 1 or 2 or 3 months it will be curable diseases. Such type of a disease condition we will write was diagnosed with. And for the long term condition diseases, that means type 2 diabetes mellitus, hypertension, cancer, Parkinson, Alzheimer's, like this type of long term condition disease will be there. In that one we have to write he has been diagnosed with. Please note that one, he has been diagnosed with. And the other doubt is that maybe the patient's disease condition is not yet find out, just they have given a question mark. That means we will call that as a query diagnosed. So, it is suspecting that maybe the patient have such type of, maybe they will give a possible or probable like that they will give. So, then you can write he is suspected to have, or you can write he is probable to have. So, please note that one like that. So, I think it is clear for you. And when you come to the, maybe the patient has underwent some surgeries like hip replacement or maybe bypass graft, like this type of surgeries if he has underwent. So, we can like that it is a post-operative period of that patient. So, you can use here he is recovering from or he is recovering after also you can write. He is recovering from or he is recovering after. So, we can go through like this. I think I make it clear for you. If you have any doubts regarding this one, please you can ask your doubts through the box itself and I will clear your doubts through that one. Thank you all. And coming to that next, second one is known case letter. You see that Non-case means that is the other most important doubt whether the students have when they will get a case note in their hand, how can I identify it is a non-case or an unknown case. So, if it is a non-case letter, to GP will be there. We know that one general practitioner will be, while seeing that GP, suddenly they will think that you will think maybe it is a non-case, but don't think like that, because if they have mentioned his GP, that means patient's GP, that means if the patient name is Mr. John, Mr. John's GP or Mr. John's family doctor. If they mention like that only, you can think that it is a known case letter, otherwise it is not a known case. You can consider that one as an unknown case. Please note that one. To GP, write a letter to GP. In the writing task they will point out, write a letter to GP. Don't think that it is a non-case. If they mention like this, write a letter to patient's GP or write a letter to Mr. John's GP or write a letter to Mr. John's family doctor, then you can consider that one as a non-case letter. And coming to that one, the second step, if the patient is in an old care home, from there only he has hospitalized. Okay, from there he was returned back to that, means discharged back to that old care home. So, you want to write the letter to, because you are the charge nurse in that hospital. So, you want to write a letter to whom? You have to write a letter to the senior nurse of that old care home. Then think about that it is a non-case letter, because already they know the patient very well about that one. So, if you want to write a letter to patient's GP or Mr. John's GP or Mr. John's family doctor, whether the patient is in an old care home, then you can consider this one as a non-case. In such type of letters, you don't want to use a refer. Try to avoid a refer and avoid the social history and the past medical history of the patient, because already they know about the social family history. You know that family history of the patient as well as the past medical history of the patient. So, it is not important for you to mention the refer and avoid social history and past medical history of the patient. So, in that letter, how you have to start? Without refer, how I can write this letter? I am writing to update. Instead of that one, you can write update. You regarding the health status. You can start like that. I am writing to update you regarding the health status, or else I am writing to update the current health status of Mr. Smith who requires. Like that you can start. I think it is clear for you about the non-case letter. And coming to the third letter will be there, that is home visit. Majority of the students will make mistakes when they are writing the letter or a home visit, because one S will create problem for one and one A will create problem for you, and what is the differences between that one. So, you see the reader, I am, maybe if it is a reader, you have to write, means your reader want to understood that you are writing, means you are the charge nurse. So, then you can write, I am writing to request a home visit. A home visit means one day visit, a home visit, and or else I am writing to request home visits more than one day. Then you can write home visits. Otherwise, you can write daily home visits. If they have mentioned in the writing task daily one, means you can write, instead of that one I am writing to request daily home visits, or else you can write alternate day, means you can write, okay, I am writing to request alternate day home visits. That is according to the students will be there. Please note that one. Don't try to mistakes whenever you are seeing. Home visit only is there. A home visit, but you see more than one day will be there, home visits, more than one day. So, there you can write daily home visits, VISITS, and alternate day home visits, like that. then you can continue that one. Balance one, it's a noun, and that's why it is no need to mention like that. You see, if you are writing, I am writing to refer Mr. John, maybe if it is a patient will be there. Maybe the dependent of the patient, maybe patient's wife is asking you, for example, Mr. Smith's wife, Mrs. Elsa, she is asking you that her husband want a daily home visits from a nurse for daily dressing and all that one. So if like this means I am writing to refer Mr. John who requested. He requested you a home visit or home visits. Like that you can miss it. So multiple home visit is there, alternate day is there, daily home visit is there. I think I make it clear for you. Maybe if you have any doubts, please clarify with that by asking the questions through that boxes. And thank you all. And coming to the next is transfer letter. Transfer is not that much tough for anyone, because we know that what is transfer letter means. The patient means from one ward to another ward, means from emergency to ortho, or from ortho to physiotherapy, like that. From one hospital to one other hospital, that means this is a difference, that is transfer letter. And I am writing in that one way, how we have to start. We can write in 3 different ways, you see. I am writing to transfer Mr. John who requires. Like that you can write. I am writing to transfer Mr. John who requires. Balance one is understood, because whatever they have given in the case note or in the task, you can continue with that one. And or else you can write like this. I am writing to refer Mr. John who requires, I make a dot because of maybe you understood that, who requires continuous care and or who requires rehabilitative care and management. He is recovering from a surgery, like that. He is being transferred to your facility. Like that you can note it down. So I think most of the students will prefer the first one, this one, because it is very easy for them, because don't make it confused or nothing at all. I am writing to transfer Mr. John, balance in that purpose will be there. So I think majority of you members choose this one, because it is make you easy for you to find out that one. And the last one, we know that the discharge letter. Discharge letter means we know that for follow-up care, further care, like that we are using that one. Which one? Discharge letters. You see, include the date of discharge in the introduction, we can add in that. For example, we know that when I am writing to refer Mr. John who requires continuous care and management, he was diagnosed with pneumonia. Then you can, it may be mentioned means he is being discharged today. You see that one is being. I will come through with that all these things in the last. And he is, maybe the patient is discharging by tomorrow. Okay, he is due for discharge tomorrow, or else you can write he is scheduled to be discharged. If they given a date for you, then you can write he is scheduled to be discharged on 3/4/2014. Like that you can change that one, because it is very clearly notify that one, because some of the students will make mistake in that one. He is being discharged. Here they don't use D. This is passive form. So when you are writing, if there is being, is being, B3 form only will come there. Discharged. So please note that one. And he is due for discharge tomorrow. That will be in the future, and he is to be scheduled to be discharged on. So this is the way we have to write the discharge letter. And coming to the next, because so many of the students where they are getting confused, madam, they will ask me questions. How I should write a letter to a dietitian, how I should write a letter to occupational therapist, and how I should write a letter to physiotherapist, how I can start, and whatever the important and relevant points that I should have to find out from that case notes. So many questions will be there. So everyone have doubt will be there. So whenever you are getting a dietitian, a letter to a dietitian will be there. What you have to note? We know that one dietitian what they need. So, they want to know the weight and height of the patient. Is it? And that is the recent weight of the patient, that is weight gain or weight loss. And the food preference of the patient, whether he is veg or non-veg. Okay. And the food allergies. And next is if the patient have any diet related disorders like diabetes, hypertension, cyst, fibrosis or pancreatic cholecystitis, like this type of disease condition will be there. So, it must be noted. And the next one, digestion and absorption of the patient. And next, dentures, artificial teeth he was wearing, and we want to know the chewing and swallowing function of the patient. So, make it clear, these all the points, relevant points that you have to point out from the case notes, and you have to mention what is the present condition of the patient. That is enough. When you are writing a letter to a dietitian, and you have to point out from his social history also, and weight, height, recent weight, gain or loss, that means weight gain or weight loss, and food preference, whether he is a veg or non-veg, and food allergy, whether he is allergic to any food, and diet related disorders, maybe he has any diabetic, he is a diabetic, or he has hypertension, cyst, fibrosis and pancreatic, and as well as cholecystitis. Like this type of conditions will be there, we have to note it to him. And next we have to look at whether his digestion and absorption, how it's. And next, the most important one, the dangers of, is it? And you see, we have to look at the chewing and the swallowing function of the patient, and how it may be. So, these are the relevant points that you have to note it from a dietitian. Whenever you are seeing a case note that you have to write a letter to a dietitian, please note all these things. And the next most important doubt will be there for you, the letter to physiotherapist, is it? Why? Because this is the most important doubt. Everyone used to ask me, ma'am, how to write a letter to a physiotherapist. So, whichever the relevant points that we have to note it. So, I think first of all we have to check it, the mobility issues of the patients. Next, whether the patient has any neuro or ortho related diseases will be there. And the regular medicine, his current medications. And you have to highlight the post-operative theory of the patient. Okay. So, we must have to note these all one. First of all, maybe we know that one, especially for a patient, those who have underwent surgeries, they need some physiotherapy, or else some other maybe due to some other conditions they need some physiotherapy or whatever it may be. Go through with that one, whichever the relevant points that we have to note through that one. First one is mobility issues. Second one, we have to check it whether the patient has any neuro ortho related disease, and we have to check the third one, the regular medicines that the patient is taking, and fourth one, we have to highlight the post-operative period of the patient. So, whether he has any problem in mobility issues or anything will be there, we have to point out in that one. And the other one is that one, majority of the students have died how to use from your facility at your facility. They will ask, maybe ma'am, where I have to use. You see, at your facility means the patient is approaching there, approaching from there. So, that time you have to write at your facility. That means he requires rehabilitative care at your facility, or he requires rehabilitative care from your facility, acquiring facility from there. So, from there, from that department, that is why we are writing from your facility. Acquiring facility, we will write from your facility, or if you have the patient is approaching, you have to write at your facility. This is the important one you have to note. The next step I will tell, a complaint of, that complaints of. I saw in so many case notes, the students have mostly confused with how I can use this a complained of or the complained of. And you see, a complained of, if the patient has one complaint, now you see, Mr. John presented with a complaint of dizziness. Only one complaint is there. There with a complaint. If patient have more than one complaint, then you have to note the complaints of. That means more than one complaint. Mr. John presented with the complaints of nausea, dizziness and vomiting. So, this is the differences. I think whether so many of the students will get confused whenever they see a complaint of or the complaint of. So, you can make a comment in the box if whether you have any doubt related to this one. You can ask me whatever the doubt that maybe whatever the confusion that you are facing in this introductions, as well as whichever the part that we have explained through that one. Now, the second one, we are entering into the grammar part of that one. That is the most important part the student must have to understand, and whether when they are writing, I know that one, especially for the healthcare professionals, they have so much confusion when they are writing, where I have to use at, in, on, off, with, before, after, like that. So many confusions will be there. So I will make a clarification for you by giving an explanation of this one. And you see, the time preposition we will tell that one. Time preposition means this indicate when something will happens. When something will happens. For example, you have to attend to the emergency department at 3 p.m. At 3 p.m. You have an appointment with the doctor at 3 p.m. You see, this indicate when something will happen. So you see, my birthday is on Wednesday. He has an appointment with the doctor on Wednesday. In February, he had met with an accident in February. In February. And you know that one, during the patient's visit. During the patient visit. You see, during is a preposition. Until the medication finishes, you can come for a review. You see, until. So, these are the time prepositions. At, on, and, during, until. I think this indicates when something will happen. So, you see, whenever you are writing, please note that one. The appointment is at 3 p.m. You make an appointment on Wednesday, and I recommended for physiotherapy in February during the patient visit. Like that you can write, he has noted with a fracture. Until the medicine finishes, you must have to continue with the treatment. You see, like this we can use the time prepositions. And coming to next, that is place prepositions. Place of prepositions means indicate where something happened. Before that I told when something happened. Now you see, place means where something happens. For example, he has come presented at the clinic on 20th February 2014. So, the doctor was in the operating room, place, pointing out that particular place. You see, he is on the third floor, on the third floor. You see, it's pointing out third floor. That means where, the place. Do you see that one? Between the radiology and pathology department, the emergency department is between the radiology and pathology department. Have to point out a place, particular place. So, this is the place of preposition, indicate where something will happen. It will point out like this. We can use at, and, on, between. So, I think whether you have any doubt related to this one, please ask me questions, and I will clarify your doubts also for that. Now, the next one is direction prepositions. Direction preposition, you see, that is movement from one place to another. Movement from one place to another. For example, to the pharmacy. He took the, means he went to the pharmacy. Mr. John went to the pharmacy. To the pharmacy, you see that one? He collected his reports, lab test reports from the laboratory. From the laboratory, you see that one? And he was shifted over to the next ward. And you see, the procedure was done under the surgical light. And you see, he walked through the hospital corridor. And this is direction preposition. It's showing the directions, that means movement from one place to another. Movement from one place to another, that is to the pharmacy, from the laboratory, over to the next ward, under the surgical light, through the hospital corridor. So, like this you can use the direction preposition. We will tell that is the movement from one place to another. And coming to the next one, that is the manner of preposition. Manner of preposition means it describes how something is done. Describe how something is done. For example, you see, that is manner only, you see, by injection. So, by injections, you can make a sentences by that one, by injection. I think some of them can use that one, and please send that answer to me in that one. On an empty stomach. He took his medicine on an empty stomach. They have given in a sterile, medicine in a sterile manner, and the patient was given with care. They provided him with care. Like that we can write. Okay, you see that one? That means they give adrenaline by an injection on an empty stomach in a sterile manner with care. That will describe how something is done to the patient. For that purpose, we will use the manner of preposition, and whichever that one, by, on, and with. Please note that one. And coming to the next is cause or reason. This is the most important part for I think all our whatever we have explained, and it's very, very important for you, the students. And the cause or reason, preposition. You see, explain why something will happen. Why something happens. You see, for example, due to viral infection, Mr. John was shifted to hospital. It is a dependent clause. You see, because of lower blood sugar, he was shifted to hospital. From lack of exercises, he lost his mobility. He has lost his mobility. Like that we can write. And you see, due to, because of, from lack of, you see, then lack of. So these are the cause or reason preposition that we are using, where explaining why something happens. Due to that one we are using this. Due to viral infection, Mr. Smith was shifted to hospital. Because of low blood sugar, Mrs. Mary was provided with any medications you can write there. And from lack of exercises, he has lost his mobility. Like that we can write. So these are the prepositions. That means especially for the cause or reasons where something will happen. In that one we are using due to viral infection, because of, from lack of. And coming to the next, I think that is a noun plus preposition. And I think I have clarified majority of the doubts that you are off in and on, how to use, where to use, when, where, why, and cause, reason, and the noun plus preposition. And you see, the risk of, the patient is at a high risk of developing, that is a noun preposition. Noun plus preposition, you see, risk, high risk of developing diabetes. You can see here. And symptoms of, you see, she presented with the classic symptoms of influenza during the in-winter season. This is symptoms of. With symptoms we have used the, with noun that we have used the preposition. Treatment for, the doctor recommended for a new treatment for her condition at the clinic. That is treatment for. And coming to admit to, you see there, he was, for example, Mr. John was admitted to the pediatric department. And see that some of them have the doubt is there. When you are writing the first point, that means in the second paragraph, Mr. John was admitted to hospital. If they are not mentioned, if you want to mention the hospital name or the department name, like this you have to write the. He was admitted to the pediatric department. Then you can use the there. Or if you want to write he was admitted to hospital, then you are not supposed to write the. Is it clear, all members? And coming to the next section, he was shifted to the emergency department. He was admitted to the Royal Perth Hospital. Like that we can write the. Then you can write when you are mentioning the hospital name or when mentioning the department name, you can write there the. And here our subject is admit to, that means noun plus preposition. Then the most important one is diagnosed with. Already we know that one. With diagnosed with, he was diagnosed with pneumonia. He has been diagnosed with cancer. So we see that one, was diagnosed with, that is the which preposition? Noun preposition. And next is recover from or recover after. That means Mr. John is, you see, it took her 3 months to fully recover from or after the operation. That means for example, you can write he is recovering after total hip replacement, or he is recovering after total hip replacement, like that you can write. So don't get it confused. I think we have go through with some of the most important nouns, and this is the other one, the duration. This is the most important part in the writing section. This is the most important part, that is for and since. Majority of the students have doubt is there, where I have to use for and where I have to use since. So you see, for means is to use for to indicate a duration of time. That means the patient was hospitalized for 5 days. That is the duration of time they are pointing out. Then we can use for. And since means that is used to indicate a point of time when an action that will begin. You see, he has been in hospital since last Sunday. Same like that you can write has had, we will write in the past medical history. He has had hypertension, then diabetes mellitus since 2001, 2011 respectively. Since, you see, from there onwards. That's why since is indicate a point of time when an action has begun. So that's why we will use since. Here you see, he has been in hospital since last Sunday. That means still also he is in hospital. And for, it is used for indicating a duration of time. That means I was hospitalized for 5 days, madam, that's why I took leave. So then you can use like this. Okay, for 5 days, that means you are pointing out the duration of time. I think these are the doubts. And coming to the last section of us, that is how to use punctuations. This is the most important part you have to understand from that one. We know that one as majority or especially we are using only 4 punctuation in our writing module, that is comma, semicolon, colon, full stop. First I will know that one, whenever you are ending a sentence with a full stop, we can keep it aside. Coming to colon, colon means where we will use, if it is a reference, is it? For the reference we will write, put a colon. If you want to write date of birth, we will put a colon, you see. And date of birth, age, we will put a colon. aged we will write downside of references will be, we will put a colon, DOB colon, reference colon in that one. Now you see comma. Comma using time, make it clear and don't make a mistakes. If you don't want to put a comma, please avoid that one, or else if you want to write before the simple connectors. Before the simple connectors, we will use the comma. Which are the simple connectors? And, but, or, for which. For which is a one word. Don't think for which is two words. Okay. And, but, or, for which. Also, it is also an simple connector. Before these simple connectors only you have to put comma. For example, I will tell that one. He was treated, he has the complaints of nausea, comma, dizziness, comma, and vomiting. After and don't put comma. Okay, because and is a simple connector. Then after complex sentences also we will use during the hospital stay, comma, he was treated with amoxicillin. During the hospital stay means it is an incomplete sentence. We will call that what as an dependent clause. So, if a dependent clause will come also we will write incomplete sentence also we will put a comma. So, for example, if you want to write he was treated with, you see, he was treated with amoxicillin during the hospital. Then you are not supposed to put comma there because he was treated with amoxicillin. It's a simple sentences and it's a dependent clause. It can stand by itself without depending upon during the hospital stay. So that's why we are not supposed to put the comma there. I think it is clear. I clarify your doubts there. And coming to next is after the compound sentences, that is two simple sentences we will put. He had a fracture, you see, semicolon. You can write semicolon, you can write and put the semicolon, therefore, comma, he underwent a surgery. This is between two simple sentences. He had a fracture, you see, it's a simple sentence only. And therefore, you use a connector. And so that's why if you are connecting two simple sentences, then you can put semicolon. If I don't put semicolon also, no problem for us. Okay, you are don't think that you will lose your marks, but you must have to keep a comma after the connector. That is important. He underwent a surgery. I think this is some of the doubt everyone have. Then after the introductory phrases and after the transitional phrases, compulsory you have to use comma, on admission, comma, currently, comma, on 20th July 2017, comma, on examination, comma, during hospital stay, comma, etc. Subsequently, comma, currently, comma, consequently, comma, postoperatively, comma, like that you have to put the commas. And after list of items, you see, as a complaint, before that I told you, nausea, comma, vomiting, comma, and dizziness. And after the incomplete sentence, use comma. That means you see that incomplete sentences we will use comma. For example, after the hospital stay. After the hospital stay, what happened? Don't know, it's unclear, it's an incomplete sentence. So we have to put a comma there. So related to that one, the sentence, it want to depend upon the second sentences to make its sense to be complete. So that's why we will call that one as an independent, not dependent clause. So that only we have tell before that one, I think. I think once again I will clarify, this is dependent clause. That means during the hospital stay. It's a dependent clause because it can't stand by itself. If it want to make its sense to be completed, it has to depend upon the second sentence to make its sense to be completed. I think I have gone through with the majority of the doubts that you are going across with writing grammars. We are writing grammars, and if you have further doubts regarding this one, you can call us, or you can contact us, or you can put comments at that one, or you can ask questions through that one, and we are ready to answer for that one. For more details, you can contact our Bemax Academy for more clarification, especially for the OET doctors and for the OET nurses. Thank you all.